Introduction. Good morning, everyone. I'm here to present the research about workplace-related ergonomic condition as prognostic factors for work-related musculoskeletal disorders in radiographers. This research was developed by Medical Imaging and Radiotherapy Department of Health School from University of Algarve, Portugal. As we all know, musculoskeletal disorders, lesions, and disease are very frequent in radiographers because of the conditions that we work and perform, because of the movement of the patient. And in this study, our main purpose was to quantify the relative contribution of work-related physical and psychosocial factors, individual factors, and working condition and health-related factors to development of musculoskeletal pain in radiographers. As our methods and materials, we performed the experimental and quantitative study. We had a sample of 40 radiographers from 2 different departments of 2 different public hospitals, and we used 4 self-applied questionnaires and a checklist about work condition and specialized equipment as a thermometer, as some others to measure the luminance, to measure the noise, and other conditions that we had in our radiology departments. We also registered the independent and dependent variables such as age, gender, schedule, professional experience, musculoskeletal symptoms, auditory symptoms, visual symptoms, and thermal symptoms. As results from the checklist, in general, we obtained good conditions for the workplace and to work of the radiographers, except the following situations, such as absence of adjustable work tables or plans, some image reconstruction stations and processing stations hadn't adjustable monitors to adjust to the height of the radiographers, so it made them to flex their necks and to have more lesions. And we observed existence of windows or other light sources reflects on the post-processing stations that also compromise the work of the radiographers and promote tension at the eyes and promote the headache. As a result of the questionnaires, we observed that 50% of the radiographer had any musculoskeletal symptoms, and the most were at the lumbar spine, neck, and shoulder. As auditory symptoms, nearly 45% considered that the noise is really disturbing and is most frequent during the shift change, primarily in the CT room, the bell of the emergency room, and the ring of the phones that is disturbing to work condition. In case of thermal symptoms, we had 70% pointed thermal symptoms, thermal discomfort, mostly due to heat of the equipments. As visual conditions, 58% referred visual symptoms, and as the consequences of it, we had headache and eye strain as the most frequent symptom as the consequence of the visual discomfort. We performed the measurements with our equipments, and we measured the luminance in the CR rooms, and in 2 different hospitals, and we had lower values at the hospital 2, as we can see in the chart. And comparing to the recommendations, we verified that the values were lower than the recommended, but they explained it as to see better the imaging because the light was interfering with visualization. At the CT room, we had similar results, and also it was lower than the recommendation, as we can see at the charts. Now talking about the noise. We had higher values of the noise intensity at the hospital 2 and at the CT modality. Because in the case of the hospital 2, it was a bigger room, it was also serving for the passage for the doctors and the other professionals, so we had observed lower noise intensity. Higher. In case of temperature, higher temperature were observed at the hospital 1, as we can see at the charts. And it was near to the recommendation values that we had in our recommendations. As we can see, the temperature was between 19 and 23. That is almost at the values that are recommended. As conclusion, we analyzed the ergonomic condition. We analyzed that ergonomic condition reveal lack of suitability in the post-processing workstation in general radiology and computed tomography, because we can't adjust it for the professional that they're working, so it promotes musculoskeletal lesions and headache, stress also. The work environment should be improved regarding the ergonomic comfort to provide better working conditions, promoting worker performance and reduce musculoskeletal symptoms. Thank you for your attention.